You mentioned that you're 28 weeks along and you've been having some preterm labor symptoms, and then I'm guessing that prompted your doctor to do a fetal fibronectin test, which came back positive. Now, the thing with the fetal fibronectin test is that we do it to test for a protein that your body starts to secrete when it's getting geared up for labor. If you get a negative result, we are 99% sure that you're not going to have a baby within 2 weeks. The data is especially strong for women who won't deliver within a week after the test. And so a negative result is always good and reassures us. But a positive result just kind of makes your doctor scratch their head like, well, I don't know what to do with this, because positive results can be falsely positive. There's a lot of things that can give us a false positive result, or it could indeed be that your cervix is gearing up for labor. All we can do is watch you a little more closely. So I'm guessing that's what your doctor has talked to you about. Perhaps they put you on bed rest or given you medications that can slow down contractions. These are things that are typical when someone's having preterm labor problems. The true definition of labor is cervical change. And so we really worry if the contractions that you're having while you're preterm are changing your cervix. And if this is happening, that would call for more drastic measures. You would be admitted to the hospital. They'd be watching you very closely. There are a ton of different medications that we can try to give women who are contracting to see if we can keep them at bay and slow them down. And we watch for other complications that can be associated with preterm labor as well. If you are still at home, it doesn't sound like you're admitted in the hospital, and you start to have contractions that are every 10 to 15 minutes, which is only like 4 to 5 an hour, or you have constant lower abdominal cramping, constant lower backache, if you feel like you're having any leaking of fluid, you have any vaginal bleeding, or you're not feeling your baby move as much as usual, those are all reasons to get checked out and can all be signs of preterm labor. Some women also notice a sudden increase in vaginal discharge associated with the pain, and that's another reason to get checked out. Basically, my motto at the end of the day is, when in doubt, get checked out, because when you're preterm, we would way rather see you sooner rather than later, so that we can stop you and not let you even get to the point to where your cervix is changing, and hopefully get you to a happy, healthy, full-term pregnancy. As we're seeing a neonatologist is a specialist that takes care of babies when they go to the newborn ICU. They are specialists at taking care of, brand new little preemie babies, so hopefully you don't have to meet one of them. You would have a chance to meet a neonatologist if you were admitted to the hospital. They would send them over and they would talk to you about the complications that could exist with your baby if they were born at certain gestational ages. So you mentioned you're 28 weeks. Heaven forbid you ended up in the hospital at this point. But then the neonatologist would come over and talk to you about long-term effects that 28-weekers usually face, as well as short-term hurdles and the things that you can expect for the following months after your baby's born. So again, they can give you a lot more information if you need them to be around, but again, hopefully you don't. Perinatologists are specialists that your OB provider might refer you to if you start to have more significant symptoms or have a high-risk case. A perinatologist is someone who was an OB at one point and went to even more school, and they're even more specialized in that area, so they can offer guidance and suggestions for OBs who have patients with a complicated pregnancy history. So really, the less people you have to meet with higher specialties, the better, because that means that things are going well for you. But stay in close contact with your OB provider and be sure to ask them any questions that you have. Get checked out if anything seems suspicious to you. But if you have any other questions for me, I hope the best for you, and you can ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.